You will hear part of a consultation between a psychologist and a patient called Mr. Barry. For questions 1 to 12, complete the notes with a word or short phrase.
Hi there, Mr. Barry. Your GP has referred you to me to discuss your anxiety. So tell me, how have you been feeling?
Well, I'm still suffering from the anxiety and panic attacks, and the medication that I'm taking, I found that it seems to have some side effects and it makes me still feel a little on edge. So I found it better to take the medication at night rather than in the morning, and so I can get on with the day kind of thing, but I still feel quite anxious.
Okay. Getting used to the medications can be difficult. Going back, when did you start the treatment again?
Oh, what, 3 weeks ago now? And that was the citalopram, the one to hopefully control the panic symptoms longer term, and the chlordiazepoxide, which is for the more short term control.
How many of the chlordiazepoxide are you using a day at the moment?
Well, the doctor gave me 20 milligrams 3 times a day, but to be honest, I'm trying to cut them out. I only use them if I really, really need them.
Good. And do you feel okay with that?
Yeah, it's like I don't feel like they suppress me enough, if you get what I mean. I know that my main aim to tackle this is, to be honest, is getting fit and more exercise because I know that's the feeling that I need to aim towards. Because I know from past experience that when I work out, I feel better, I feel more relaxed, etc. So I'm trying to work towards that.
So, how many actually are you having at the moment?
Today, I've had to go into work just for a conference with my manager, just to discuss how things are going and stuff. So I had to take two because I just felt like I couldn't manage it otherwise.
Right, okay. So, over the past 4 or 5 days.
None except for the two today.
So, you've actually been laying off them altogether.
Yeah, I've been trying, and when I do take them, I only feel suppressed for a very short amount of time.
Right. Now, the citalopram medication.
Yes, I'm on 20 milligrams once a day, and the side effects, headaches, were quite bad to begin with, and I'm still getting them. But I think that could be more stress related because they're not very, I wouldn't call them painful headaches. I just can feel they're there. I also had a sore ear, so I wondered if I might just have an infection or something too.
Okay, we'll come back to that. But you're now taking this citalopram at night.
Yeah, I found that if I take it first thing when I get up, I still feel quite edgy, and also the side effects.
Yes, okay, right. Now, the reason you started the treatment was because you were getting full-blown panic attacks. Can you tell me a bit more about the attacks?
Yeah, well, I couldn't leave the house. My heart races and I really struggle to breathe, and I just feel an intense fear. It makes me feel sick and dizzy if I go out into the street.
You find it very difficult to get out and about. Are you beginning to normalize, do you think?
Yes, I've managed. I went over to the soup store on my own and I managed. I felt a bit jittery at first, but I've learned over the years after suffering quite severely with them years ago that you just have to take your mind to a different place and I just concentrated on what I wanted from the shop. That was the first time I've been out on my own since I started on the medication.
You will hear part of a consultation between a GP and a patient called Mr. Martin. For questions 1 to 12, complete the notes with a word or short phrase.
Hello, Mr. Martin. I'm Dr. Hampton.
Hello, nice to meet you.
And you? How can I help you?
Well, I've come about my stomach. I've had problems with it over the years, on and off, but at the moment it seems to be worse again. Mainly kind of just real sore feelings across here.
Okay. When you get the pain, where is it exactly? Can you show me?
Yes, it's here. It's sort of across the upper part of the tummy and down here to the middle of the tummy.
Uh-huh. And how would you describe the pain? Could you put words to it?
It's more sore. I can't say it's a real pain. It's more a sore feeling and like irritation, maybe?
Right. Does it move around or is it always in the same place?
Yeah, I mean, sometimes it always seems to start here in the middle, kind of. I can feel a bit there now, but I've had it more down each side as well, and I didn't know. At one point, I wondered whether it was my kidneys or something, or whether it's still the same thing. I don't know.
Okay. And you said it's both sides. Do you mean together or does it sort of flip from one side to the other?
Yeah, not together. It goes from one side to the other.
So it really moves around this pain, doesn't it? Do you get bloated when you get the pain?
Yes, very bloated.
And can you tell me how long this has been happening?
Well, I first had it several years ago. I had it when I was working, and a doctor I went to see said then it was probably irritable bowel. That was 4 years ago.
Right. Was the bloating a part of that too?
Yes.
And did things settle down for a period of time?
Yeah, they settled down when I was watching my diet much more, and when obviously I wasn't as stressed. I'd given up work.
Okay. What about your bowels? Can they be a bit variable?
Yes, very much so.
Could you tell me a bit more about that?
Well, I've always had a bit of a problem with constipation, mainly. But I mean, I'm going just recently going perhaps a couple of days and not really going. And then, like in the last couple of days, every time I eat, I seem to want to go.
Right. And are you getting loose motions?
It's loose, yes.
Right, okay.
Yeah, I mean, really, nothing has changed. I mean, I drink loads of water, but when I'm constipated, it's really hard and just like, like small brown pieces when I go. And then when it's loose, it's a bit ribbony. I've always had a bit of a ribbony movement.
Yes. Is it true diarrhea or not?
No.
No. Okay. Have you passed anything unusual looking? Any blood or slime or anything strange?
No, I haven't.
Haven't passed black motions as far as you know?
No.
When you had the IBS before, what sort of things did you do for it?
I think Dr. Dorsey gave me some Colofac, is it? Or something like that?
Yes, that sounds right. Was that helpful?
Kind of. Because she explained to me about a kind of a spasm thing. But I just kind of watched what I ate again. I mean, it's probably worse if I don't go to the toilet. And so, I try to eat things and, to make sure I do go without taking anything, without any laxatives of any description. And then I know it's probably really old-fashioned, but I take peppermint oil. You know the capsules? And I think they're actually really helpful.